going to talk about the new form of coronavirus, that's novel coronaviruses. As of the 24th of January 2020, human-to-human transmission has been confirmed largely in Wuhan city and other places of China and internationally. There are many questions raised, such as, what is coronaviruses? Coronaviruses, CoV, are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome, MERS-CoV, and Severe Acute Respiratory Syndrome, SARS-CoV. A novel coronavirus, nCoV, is a new strain that has not been previously identified in humans. Coronaviruses are zoonotic, meaning they are transmitted between animals and people. Detailed investigations found that SARS-CoV was transmitted from civet cats to humans and MERS-CoV from dromedary camels to humans. Several known coronaviruses are circulating in animals that have not yet infected humans. Sign and symptoms. Common signs of infection include respiratory symptoms, fever, cough, shortness of breath and breathing difficulties. In more severe cases, infection can cause pneumonia, severe acute respiratory syndrome, kidney failure and even death. Preventive measures. Standard recommendations to prevent infection spread include regular hand washing, covering mouth and nose when coughing and sneezing, thoroughly cooking meat and eggs. Avoid close contact with anyone showing symptoms of respiratory illness such as coughing and sneezing. Now there are many questions arises in your mind, such as, above all one can think, is there a vaccine for a novel coronavirus? When a disease is new, there is no vaccine until one is developed. It can take a number of years for a new vaccine to be developed. Can coronaviruses be transmitted from person to person? Yes, some coronaviruses can be transmitted from person to person, usually after close contact with an infected patient, for example, in a household, workplace, or healthcare center. Are health workers at risk from a novel coronavirus? Yes, they can be, as healthcare workers come into contact with patients more often than the general public. World Health Organization recommends that healthcare workers consistently apply appropriate infection prevention and control measures. Precautions. World Health Organization standard recommendations for the general public to reduce exposure to and transmission of a range of illnesses are as follows, which include hand and respiratory hygiene, and safe food practices. 1. Frequently clean hands by using alcohol-based hand rub or soap and water. 2. When coughing and sneezing, cover mouth and nose with flexed elbow or tissue, throw tissue away immediately and wash hands. 3. Avoid close contact with anyone who has fever and cough. 4. If you have fever, cough and difficulty breathing, seek medical care early and share previous travel history with your healthcare provider. 5. When visiting live markets in areas currently experiencing cases of novel coronavirus, avoid direct unprotected contact with live animals and surfaces in contact with animals. 6. The consumption of raw or undercooked animal products should be avoided. Raw meat, milk or animal organs should be handled with care, to avoid cross-contamination with uncooked foods, as per good food safety practices. 7. Above all, avoid international travel. Protect yourself and others from getting sick. Please like, share and press bell icon for such other informative videos from Pharmacy Times India. Thank you for watching.
Shortly in the next part of video coronavirus, see the interesting facts about the virus and our world.